Good afternoon, everyone. Myself, Dr. Grishma Gupta, and I'm live here again on this prestigious platform of Coltene to share my views on another interesting topic. In my previous webinar, I discussed about rubber dam application, which is helpful in maintaining the properties of dental materials by keeping these materials protected from saliva and other tissue fluids. Today, I'll be discussing the most frequently used dental material in today's scenario, that is, the composites. So, our topic for discussion today is the magnificent world of composites. The contents of my presentation are introduction, then the composition classification, history and evolution of composites with special emphasis on the filler content, physical and mechanical properties of an ideal composite material, properties and advantages of brilliant everglow and brilliant everglow flow, properties, advantages and studies related to synergy D6 and synergy D6 flow, and then after conclusion. English novelist Charles Reade once observed, "Beauty is power, a smile is its sword." Indeed, our ability to smile is one of the most profound nonverbal communication skills we humans have. A smile is universally recognized and identically interpreted by every culture on the face of the earth. Smiling exerts a positive influence on our personal and professional relationships, and some researchers believe it positively impacts our physical and mental health. Public opinion polls confirm that nearly 90% of adults feel that an attractive smile is an important social and career asset. But what to do in these conditions when fractured teeth or midline diastemas or general diastemas result in lowering of confidence of a person? Patients in these cases would like to opt for an option which is economical, requires lesser number of visits to dentist, most importantly minimally invasive, and acceptable longevity of the restoration. Well, the answer is here in the form of a biomimetic approach to direct restorations with the help of brilliant everglow and brilliant everglow flow, synergy D6 and synergy D6 flow. Now, before moving further, I would like to bring to your notice the composition of dental composites. So, the dental composites are basically composed of a matrix phase, a filler phase, and a silane coupling agent, which is responsible for binding the matrix and the filler phase. The matrix phase may maybe consist of dimethacrylates or vinyls or click chemistry monomers or expandable monomers. And the filler phase consists of filler particles which are usually a radio opaque glass, but that could be any other thing also. We look after the various type of fillers in the upcoming slides. What happened in the filler phase, the things like size distribution of fillers, content and size of filler particles, interfacial properties and porosity of filler particles, shape and morphology of filler particles matters the most, and this affects the final properties of the composite materials. Now, next comes the classification of dental composites. Dental composites are basically classified as either packable or flowable composite. The difference is that of the consistency. In the flowable composites, the filler content is decreased so that the flowability of the composite material increases. Now, the coming to the major classification of the dental composites, the first one is macrofill, as you're able to see in the on the lower leftmost corner of the picture. So these macrofill composites were basically quite strong, but they were difficult to polish and impossible to retain the surface smoothness of the same. These composites had the average particle size that far exceeded 1 micrometer. So, to address the important issue of long-term aesthetics, manufacturers begin to formulate microfill composites, as you can see in the upper leftmost picture. So, these were actually inappropriately named at that time, but probably done to emphasize the fact that the particles were microscopic. The microfill composites were polishable but generally weak, which is quite obvious due to their relatively lower filler content, and a compromise was needed to provide adequate strength with enhanced polishability and aesthetics. Therefore, the particle size of conventional composites was reduced through further grinding to produce was what was ultimately called a small particle hybrid composites, as you're able to see on the right uppermost picture, which consists of two classifications, mid filler and mini filler. Further refinements in the technique in the particle size through enhanced milling and grinding techniques resulted in composites with particle size that were sub-micron, that is almost zero point 0.4 to 1 micrometer. These were initially known as minifills, but actually they were microhybrids. The most recent innovation has been the development of nanofill composites containing only nanofin particles. As we are able to see in the lower picture, it consists of either nanofillers or nanoclusters. Nanofillers are just the particles, the filler particles which are scattered throughout the matrix, and nanoclusters are basically cluster of the nanofill particles, and these clusters are then added into the resin matrix. So, in general, it is difficult to distinguish nano-hybrids from the microhybrids. Their properties, such as flexural strength and modulus, tend to be similar with the nano-hybrids, as a group being in the lower range of the microhybrids and both being greater than microfills. While some have shown evidence for reduced stability during water storage for nano-hybrid or nanofill composites versus microhybrids, others have shown a Now, the history and evolution of dental composites. The composition of resin-based dental composites has evolved significantly since the materials were first introduced to dentistry more than 50 years ago. As we can see here in this picture that they were first introduced in 1950s as glass-filled polymethyl methacrylate. In 1960s, bisphenol A glycidine dimethacrylate was introduced to the chemistry of dental composites. Then, after from self-cure or chemically cured composites, we moved on to UV cured, that is ultraviolet light cured composites. Then, from ultraviolet light to visibly light cured composites. Then, some other monomers like vicryl or click monomers were introduced into the chemistry of dental composites. Then, after we moved on from macrofill to microfill, from microfill to hybrid, from a hybrid to small particle dental composites. Then, after we were able to distinguish between flowables and packables. Then, after this, a small particle were again modified into microhybrids. Then, after nanofills and nanohybrids were introduced. So, until recently, the most important changes that have involved the reinforcing filler, which has been purposely reduced in size to produce materials that are more easily and effectively polished and demonstrate greater wear resistance. Now, the greater wear resistance is especially necessary for materials used in posterior applications, uh, but the material being effectively polished, this property has been important for restorations in all areas of the mouth. So current changes are more focused on the polymeric matrix of the material, principally to develop systems which reduce the polymerization shrinkage, is stress, and they should be self-adhesive to the tooth structure. Now, the requirements and characteristics of dental resin composites. A longevity or survival rate as a measure of the success of restorative dental treatments significantly depends on the true properties of the dental composites in physical, mechanical, biological, and practical aspects. So, first of all, we'll talk about the mechanical and physical characteristics in which elastic modulus and strength matters the most. The elastic modulus and strength of dental composites are fundamental mechanical properties. The elastic modulus represents an intrinsic mechanical property of the material which quantifies a resistance against the applied loads, whether it's compression or tension in the elastic deformation region. The dental composites therefore can be expected to have sufficient modulus values to resist the masticatory forces, and spatially they are designed to possess higher values in posterior restoration because the occlusal forces on the tooth are higher in the posterior as compared to the interior areas. Also, the difference between the elastic moduli of the layered restoration or difference in elastic moduli from the dental tissues will increase the possibility of interfacial failure or marginal fracture. So ideally, dental restorations require attributes exhibiting a similar elastic modulus to hard dental tissue so that the restoration will have equivalent stress and deformation to the healthy tissue by minimizing the damage on the surrounding or opposite tooth under the various occlusal loads. So as we can see that it's written over here in the mechanical performance, the wear resistance, strength and modulus, toughness and hardness. So these all factors are interrelated to each other and they somewhere depend on the the moduli of elasticity of the dental material used. The viscosity of the material also matters. Like we have already discussed that there are two type of materials, flowables and packables. In flowables, as the filler content is decreased, so the polymerized shrinkage is supposed to be higher. However, researchers are still going on to increase the filler particles even in the flowables, and at the same time maintaining their low viscosity and increased flowability, and at the same time reducing the polymerization shrinkage. Now, when we talk about polymerization shrinkage, it can be divided into two stages, a pre-gel and a post-gel. Pre-gel is when you have just applied the material into the cavity or onto the tooth structure. So at this time, structural damage will take place, but the stress is going to be minimal. And when you have cured the material completely or when you are curing the material, the stress which is going to develop is the maximum. In terms of biological performance, researchers are still going on to make the material antimicrobial, make the material having the properties of remineralization, just like our bioceramics. They should have reduced toxicity, and because of this, many of the products are not having bisphenol A, glycine dimethacrylate as a constituent in their chemical composition, and also to decrease genotoxicity. When we talk about the practical performance, the properties that matter the most are the thixotrophy. They should be self-adhesive. They should be easily polishable. Aesthetics should be good, and discoloration should not happen. If the material is, if you're able to polish the material easily, and if it is able to maintain its gloss for a longer duration of time, so obviously it is going to enhance the aesthetics, and it should not be discolored by the usual beverages or the food materials which are taken by the patients. We have already seen the dimensional classification of the fillers which are added into the dental resin composites as macrofill, microfill, nanofill, etc. Geometrically, they can be classified into particulate, fibrous, and novel shape fillers. Particulate fillers include ground quartz powder, ground glass powder, colloidal silica, nano powder, hydroxyapatite powder, and pre-polymerized powder. Fibrous fillers include microviscose, short glass microfiber, ceramic nanofiber, polymer nanofiber, and nanotube. And novel shape fillers include porous and mesoporous powder, urchin-like hydroxyapatite powder, nanocluster powder, tetrapod-like whisker, core sheath fiber, glass flake, and microcapsule. So basically, the change in the morphology of filler particles are having a great significance in the final properties of the dental resin composites, because there is modified bonding capacity because of the presence of these new fillers. As these are having various kind of shapes, so the void which was created in between the filler particles, I'm talking at the microscopic level, that when you have added filler particles into the resin matrix, there is some space which is being left in between the filler particles. Like for example, if there is spherical particles, then space will definitely remain in between those spherical particles. So when we are using various shapes and various fibers and so many type of shapes in the filler, as filler particle, these voids are going to diminish there. So the filler particles are going to be tightly packed into the matrix, and this is definitely going to increase the mechanical properties, the strength, and the wear resistance of the final product. So, after learning about the composition, the classification, and the evolution of composites, we can now infer that what all specific things a dentist should consider when choosing a material to restore teeth in both anterior and posterior segments. These are high mechanical properties, high wear resistance, which are dependent on elastic modulus and strength of the material, excellent aesthetics, especially in the interior areas, strong adhesion to dentine and enamel, high color stability, fast polymerization reaction, and resistance to degradation by moisture, enzymes, and bacteria. And now we come to the answer, that is brilliant Everglow. It is a highly filled radio-opaque universal submicron hybrid composite. Universal because it can be used both in anterior and posterior segments. It is a submicron hybrid composite. So, the filler particles are manufactured by enhanced milling and grinding techniques so that the further refinements in the particle size can be done. And the average inorganic filler particle size here ranges from 0.02 to 1.5 micrometer. These are available in universal, translucent, and opaque shades. The composition consists of methacrylate for the resin matrix, dental glass, and amorphous silica as the filler particles, and zinc oxide as an additive. This brilliant Everglow line comprises 7 universal, 2 translucent, and 5 opaque shades. They integrate so well into the existing surroundings that one shade covers two VITA shades at a time, like for example A1B1 or A2B2. Now the brilliant Everglow universal shades bleach, that is A1B1, A2B2, A3D3, A3.5B3, C2C3, and A4C4. These are indicated for direct filling of class 1, 2, 3, 4, and 5 cavities. Interestingly, this is a universal composite which can be used in interior and posterior areas because of the very high strength and polishability at the same time. They can be used for the luting and repairing of ceramic and composite restorations like brilliant components, and they can be applied either separately or in combination with opaque or translucent shades. Now, as we have seen that it is having the brilliant Everglow is having two shades of colors in one compose, and as you can see from the picture which is shown over here, this shows a comparison between a universal composite system A2B2 used on a case and a single shade system used on the case. So the universal composite system A2B2 is having dual shades in a single compule, and it is so good to restore even a posterior stress bearing area in a way that it mimic the tooth structures so closely, that is the enamel and dentine so closely that it become just impossible to recognize the natural tooth structure and the composite material. Also, the presence of opaque systems significantly expands the clinical capabilities of this composite. Brilliant Everglow, due to the unique physical features, has excellent initial adhesion, that is, adhesion to both enamel and dentine, and the plasticity during the modeling of the restoration is also very good. That is, ability to hold the form is very good. So the Brilliant Everglow translucent shades are available in two shades, that is bleach translucent and translucent. And these are indicated for shape and color corrections to enhance the individual aesthetics, reconstruction of incisal edges as in fracture or caries exposure, luting and repairing of ceramic and composite restorations like brilliant companions, and it can be applied separately or following the universal shade as a coating layer. Brilliant Everglow opaque shades, opaque bleach, opaque A1, opaque A2, opaque A3, and opaque A4 are indicated for aesthetic corrections, that is chroma deviations, masking of dark areas, and forming of a dentine core. Material is easily polished even by the standard polishing composite systems, while the gloss is maintained stable even after long-term clinical control after treatment and can be described as the effect of dry shine. Due to the presence of composite masses with different transparency and shade dual system, this composite system has excellent color rendering properties, allowing successfully solve almost any clinical problems of aesthetics of the dental hard tissues, including teeth restoration of the previously endodontically treated teeth. The masking ability of Brilliant Everglow is controlled by the thickness of the layer. To achieve an optimal blending effect, it is suggested to keep the total opaque shade layer thickness as small as possible and to cover it with universal shades. It is well known that Brilliant Everglow is a highly effective composite for solving any clinical situation, including the ceramics correction. This material has the properties and characteristics that we perceive as the concept of true Swiss quality. This is a graph which shows the variation of average values for Vickers height microhardness number. Few materials like Synergy D6, Let Lukes, Herculite XRV Ultra, and Brilliant Everglow were compared. And these tests revealed that direct composite resin Brilliant Everglow from Coltene present the highest value of Vickers microhardness. A high viscous microhardness value of a restorative material is directly related to the durability of the restoration as it provides increased wear resistance, establishing a direct correlation between hardness and wear. When low microhardness results are obtained, the risk of dissolution of the composite organic matrix followed by exposure of the inorganic particles increase. The restoration roughness and the consequent accumulation of bacterial plaque contributes to the restoration longevity decrease. Sculpting of a composite material is a very important property, either you are working in the posterior or the anterior region. If you want to mimic the natural or the original dental anatomy, then the material should remain in place until and unless it is being carved by the dentist. So the flow variants, that is this material, brilliant everglow, it remain in place because of the thixotropic properties of the material, and it can be modeled until polymerization at the practitioner's leisure. So in this way, a very natural looking tooth structure or very natural looking restoration can be made. Effect of green tea, tulsi tea, and areca on the color stability of brilliant everglow and brilliant NG were investigated with the help of spectrophotometric analysis. All herbal tea preparations exhibited staining potential, which increased over time, and areca tea showed the highest staining potential. So, understanding the staining potential of newer tea preparations on recent composite materials helps the clinician to choose the right restorative material. So whenever we are using Brilliant Everglow or any other composite material, we should always choose the material wisely as per the lifestyle or the eating habits of the patient. Next is Brilliant Everglow Flow. As you're able to see that there is a series of questions shown on the screen right now, and I'll answer all those questions one by one. So make it better to make you understand that why Brilliant Everglow Flow is the best material. So first of all, this is a universal composite based on the submicron hybrid filler technology. Now, what makes this new submicron filler technology so special? Uh, Brilliant Everglow Flow shows an outstanding polishability and gloss retention, and the key to its performance lies in the submicron filler technology, which is already there in Brilliant Everglow also. It consists of submicron barium glass fillers, and on the other hand, pre-polymerized fillers are added. So, what does these pre-polymerized fillers do? Because they are pre-polymerized, the polymerization shrinkage which develops after curing the composite material decreases a lot. In fact, it comes to no polymerization shrinkage. So it ensures low polymerization shrinkage. There is reduced stickiness to the instrument, and it can be sculpted quite easily. Brilliant Everglow Flow also does not contain bis-GMA, that is bisphenol A glycidine diamethacrylate. Because of this, the cytotoxicity of the material decreases. Now, the clinical situations in which it is indicated in all the clinical situations, whether it is anterior or the posterior one. It should be applied in a 2 millimeter increment and can be cured accordingly. What all adhesive system the Brilliant Everglue Flow is compatible with? It is compatible with most of the adhesive systems which are available right now with Coltene. And how does the blend-in effect of Brilliant Everglow Flow work? So this is because of the light scattering and light reflection on the internal composite interfaces and a suitable translucency. This composite takes up the shade from the remaining natural tooth substance in the surrounding. Brilliant Everglow Flow syringe always comes with two application needle sizes. In addition to the standard size with an inner diameter of 0.8 mm, the accessories provided have been extended by a fine size. With only 0.4 mm inner diameter, it allows for highest application precision. The shade guide which is available along with Brilliant Everglow Flow is having all the shades, and these shades are made up of the same composite material which we are going to apply on the natural tooth structure. So this is not similar to the VITA classic shade guide in which the material which is used for making the shades, it's something different from the actual material which you are going to apply on the tooth. That means they all are made up of ceramic material, and here we are supposed to apply composite material. So shade selection will be better if we are able to match the shade with a material which is similar, which you are going to apply onto the natural tooth structure. Next is Universal Nano Composite Synergy D6. This universal composite is completely focused on simplifying shade selection without neglecting the aesthetic aspects. Its consistency is firmer compared to Brilliant Everglow, and a special feature is the dual shade system which applies for 6 of the Dentine shades. It is having excellent optical self-blending properties, and one dual shade matches two VITA shades, for example A1 B1 or A2 B2. As a result, a small number of shades is sufficient to cover a wide range of tooth shades. The filler content is almost 88% and the average filler particle size is zero point 0.6 nanometer. It consists of bisphenol A diglycidine methacrylate, bisphenol A diethoxymethacrylate, triethylene glycol dimethacrylate, urethane dimethacrylate, barium glass which is selenized, amorphous silica which is hydrophobic, and prepolymerized filler. The function of prepolymerized filler is to decrease the polymerization shrinkage as I have already explained. The Brilliant Everglow Flow comes with all the quality characteristics of the Brilliant Everglow filler technology. Although the universal and translucent shades serve most cases, dark areas and chroma deviations can negatively affect the final aesthetic outcome of a restoration and demand for an opaque cavity lining. The opaque shades, that is OA2 and OA3, were developed to suit this need by creating the basis for an harmoniously shaded and aesthetic restoration. Synergy D6 Shade Guide features a unique nesting shade selection option when performing restorations using the layering technique. As you can see on the right side of this slide, that it is having a dentine dual shade. So we are using a dentine dual shade here and an enamel shade. And when putting the enamel shade over the dentine dual shade, we are doing the nesting of enamel over dentine, and in this way we get a final nested shade. So whenever you are using a layering technique, you can easily match the color of dentine and enamel separately and then after one over the other, so as to come to know that what will be the final outcome when we will be applying dentine shade and enamel shade at the same time. Now, this is a graph which shows the comparison of four materials, that is Myris 2 Dentine by Coltene, Synergy D6 Enamel again by Coltene, ELS and Clearfill Majestic. This graph shows that Myris 2 Dentine and Synergy D6 Enamel were rather similar and seem to exhibit little deformation or slumping. Slumping is a very important characteristic which is required to be there in the modern composite materials used. If the material is not deforming easily or it remains in its place in the original shape as applied by the practitioner or the dentist, then obviously the slumping is less and it will be able to maintain the natural anatomy of the tooth or whatever shape the practitioner is given to the composite material. The material will be able to retain that shape for longer. Now, next in the series is the Synergy D6 Flow. In March 2009, Coltene introduced a new nanofill and X-ray opaque flow composite, that is Synergy D6 Flow. It is based on the proven and successful technology of Synergy D6 with the excellent mechanical and aesthetic properties of the flow material. The few uses of Synergy D6 Flow include that it can be used as an independent filling material. It is used in this way to seal expanded fissures, mainly minimally invasive filling of cavities in the anterior and posterior tooth regions, and for class 5 cavities. It can also be used as a supplement to a well-filled moldable filling material such as Synergy T6. It can be used to repair existing restorations. It is also suitable for cemented in placement of ceramic restorations where complete and sufficient light curing of the material can be assured. Along with that, when you are cementing a ceramic restoration, it is not necessary to apply glycerin at the final curing step of the ceramic restoration because no oxygen inhibition layer is formed at the restoration and tooth interface. When using composite paste that have the same composition, it is usually recommended to create an intermediate layer that will act as a boundary between the dentine and enamel shades to reproduce the specific changes in light direction which is observed at the dentine enamel interface of the natural tooth, as it can be seen in the two graphs given over here. With the composite materials like Brilliant Everglow and Synergy T6, this is no longer necessary as dentines and enamels are based on different formulations and already emulate the light behavior observed in a natural tooth. Next, we will discuss the various principles of smile designing to get the best aesthetic results. The smile line or the incisal line is the imaginary line joining the upper incisal edges and canine tips and should generally follow the curve of the lower lip on smiling. The leftmost picture shows the incisal line which is denoted by the point D. The right picture shows that ideally on smiling, the entire labial surface of the central incisors should be revealed and approximately 0 to 2 millimeter of marginal gingiva should be revealed. The resting incisal display, often referred to as the M position, which can be recreated after asking the patient to say M, should average approximately 1 to 2 millimeter in young males and 3 to 4 millimeter in young females, which is shown by the first picture. Restoration should be designed to allow the interdental papilla to fill each interdental embrasure as shown in the middle picture. And the upper central incisor midline should be vertical and perpendicular to the intrapupillary line, a line which passes through the center of both the pupils. Ideally, the midline should correspond to the facial midline, but deviation of up to 4 millimeter is usually not detectable, which can be shown here in the picture on left side. In an aesthetic smile, the edges of the maxillary anterior teeth follow a convex or gull-wing course matching the curvature of the lower lip. When making an F sound, the tips of the central incisors should touch the lower lip at or just behind the wet to dry border. Now, in the frontal view, there exists a width proportion of teeth seen in perspective. This fact is shown in the very first picture, in which visible lateral incisor width accounts for 62% of the central incisor width, while canine width accounts for 62% of the lateral incisor width. This is known as the golden proportion or the golden ratio. The second picture shows that the central incisors should dominate the patient's smile and be symmetrical to each other. Special attention is given to disposition of anterior superior teeth, that is, canine to canine or first premolar to first premolar, or the area which is known as aesthetic zone, where central incisors are known as key elements and characterize the term dominance of central incisors. In short, central incisors must be highlighted as true protagonists of smile. The ratio of width to length dimension of a central incisor should ideally be between 75 to 80%. The distal incisor line angles should be more rounded than their mesial counterparts, and the incisor embrasures should increase in depth, moving distally from the midline. While the majority of lateral incisors are asymmetrical, their incisal edges should be approximately 1.5 to 1 millimeter short than those of the central incisors, and their maximum width approximately two-thirds that of the central incisor. And the frontal smile should show only the mesial half of canine teeth, and the long axis of all the anterior teeth should ideally be slightly mesioangular. Now, next we will talk about the various principles of shade selection. It is always good to record your shade selection in the natural daylight, and if it is not possible, then the dental office should be lighted with a corrective light with a color reproduction index of around 90 and average temperature of 5500 degree Kelvin. There are LED fixtures that hold lamps with those features. It is important to take the shade under another light source for confirmation and to avoid metamerism. Metamerism is a property in which the same object appears in two different colors in two different light sources. If we divide this corner tooth portion into three parts, that is occlusal or incisal third, middle third, and the cervical third, then all these areas will be having different optical properties. First, we will talk about the incisal third. The incisal third showing the greater proportion of passage and lower amount of reflection. That area, as a rule, preferably should receive translucent enamel material and a thin layer of dentine material. The middle third, here the predominance of light reflection and a little passage of light take place. This area as a rule should receive predominantly dentine material and a very thin enamel layer that is 0.5 millimeter or less in thickness. Opaque material may be used for masking a darkened area. And the cervical third, where there is the evident domain of light reflection with virtually no passage of light at all. In that area, it is possible to observe greater chroma or saturation, and one should only use dentine material, that is opaque material, just to mask if necessary and eventual sclerotic dentine. The first picture shows that the incisors with mammelons and dense appearance which appear in a young patient. And the second picture shows the dentition of an adult patient, which is the interior zone in an older patient. So we can clearly see that there are many changes in the anatomical form, shape, size, color, and shade of the dentition. So whenever we are doing shade selection, we should always keep in mind the age of the patient and the physical appearance of the patient too. Now, the central picture shows how to determine the thickness of the enamel layer. The principle behind using both Synergy D6 and Brilliant Everglow is to mimic the natural tooth structure. The composition of both these materials allows to use the dentine and enamel shades in the same thicknesses as the dentine and enamel in a natural tooth are. This picture shows that how much thickness of enamel and dentine should be present in what all areas. The third picture shows how to select the correct dentine and enamel shades. An easy and accurate way to select the right composite shades is to use the composite button technique. It consists of applying small pieces of composite onto the tooth, obviously without the bonding agent, and then light curing them. In this way, the shade closest to the one of the natural tooth can be determined. So we apply the composite pieces in the most representative tooth area for each shade, like cervical third for dentine and incisal border for enamel. To prevent inaccurate shade selection due to tooth dehydration, immediately we should apply all the composite buttons on the tooth. And taking polarized pictures can help us to select shades even more easily and accurately. Now, any of these three can be used for recording the shade. The first one is the VITA Pen Classical Shade Guide. Second one is VITA Value Guide 3D Master. And the third one is the Computerized Shade Guide. Using all three modalities for shade analysis and comparing the data has proven to be the most accurate way to finalize the exact shade determinant and more importantly the best way for reproducing it with either porcelain or composite. But it is always advisable to use the shade guide which is made available by the manufacturer himself. All the manufacturers still follow different color concepts and suggest a variable number of layers. Predictability of the aesthetic outcome has clearly improved. One more common approach and trend is to analyze first the tooth optical composition and apply the minimum number of layers required to emulate optimal restoration integration with surrounding natural tissues. Simplicity and predictability are undoubtedly the new driving forces to continuously improve the quality of direct composite restorations. The similar principles were kept in mind while developing the two important products, Synergy D6 and Brilliant Everglow. So I'm concluding my presentation today. And if you have any suggestions or queries, you may please share the same on the group. And I would like to thank Coltene again for giving me this chance to interact with all of you. Thank you so much.